The reason why I feel so passionate about airway-focused dentistry is that I've personally suffered. I had extraction retraction orthodontics when I was a child. My mouth was really small, my teeth were bucked, something had to be done. And what they did is the exact opposite of what should have been done. They should have created more room in my mouth for my teeth to fit. They really didn't know any better to a certain extent. This was back in the 80s. But I've suffered a lot from that. I've clenched my teeth, my sleep's been less than perfect. So I really want to see to it that as many people as possible don't have to go through what I went through as a kid. Then when I transitioned into my dental practice, I noticed a lot of things. Number one, I noticed that a lot of the people that had these small mouth, poor occlusion, poor sleep issues like I had were getting a disproportionate amount of dental damage in their mouth. I was noticing that they clenched their teeth at nighttime, that they would get a lot of wear, they would get a lot of cracks in their teeth, and they ended up needing a lot of implants and a lot of crowns. And I realized that the root cause of a lot of the dental damage that I saw that my patients were suffering from was caused by airway problems. So I felt very compelled to try to get into a position where I can help people not go through what I went through, and additionally save them all kinds of dental damage and destruction and pain and suffering on their teeth. The real goal in my practice right now is to help kids get corrected so they don't need to go through what I went through. And additionally, to help adults that are constantly suffering from issues with airway and bad occlusion to get a better direction and get solutions that can actually help them and correct some of the problems that they're having and help them get to a point where they don't have pain and they have good sleep. The way we help our patients that are kids is they come in with their parents at varying ages of growth and development, and we take a look at some of the things that are causing their mouths and jaws not to grow to be the right size and shape. We'll work on correcting these things. Normally we're talking about lip ties and tongue ties that are not creating the proper growth and development factors to get their jaws to grow to be the right size and shape. We correct these things. We get them into myofunctional therapy. We get them expanders that can get their mouth to be the right size and shape that they should be for that age. And long story short, we help them with their growth and development so that we can truly correct and avoid any problems with airway and occlusion throughout their life. The way we help our adult patients is we really focus in on what's going on in their day-to-day life. Some of our adult patients are having a lot of pain. Other ones are suffering from sleep. They're not ever getting a good night's sleep. We can never really truly 100% correct our adult patients' problems, but we probably can be successful at getting things 50 to 80% better and getting people to a point where they can improve their life and get rid of some of the complaints that they have when they come to the office is our first goal. For people that are having TMJ pain, we focus in on the instabilities in their bite. We try to figure out a way to get their teeth and their jaws to align in a more neutral, comfortable way because the biomechanics is leading to a lot of neck tension, jaw tension, headaches, worn teeth. Our adult patients that are suffering from poor sleep probably don't have enough room in their mouth for their tongue. They're not closing their mouths properly. They're not breathing through their nose. They need expansion, myofunctional therapy, and all the things they're going to be focused on immediately improving their airway so they can get better sleep.